Hi everyone, welcome to Hoopsters Presents The Beautiful Mind. The idea behind The Beautiful Mind is to talk about a lot of taboo subjects, especially mental health issues. And the goal is to create as many alert and aware citizens as possible. And in today's show, we have with us Dr. Vinod Kumar, who is the head of Empower the Center and is also a leading psychiatrist in India. And the subject we're talking today is actually pretty interesting. It is a very interesting subject we're talking about today, which is OCD or Obsessive Compulsive Disorder. So for those of you who watch TV shows like The Monk, you're probably slightly aware of what it is, but let's get into the actual science and the details of what this illness is all about. Hello, doctor. How are you?
Hi, good evening, everybody.
So my first question to you is, why did you agree to come on this show?
I think, like what you said, my ethos is very much in sync with the ethos of Hoopsters, which
Right.
is to promote more mental health awareness.
Mm-hmm.
And the general person, an average person, should be well versed with mental health issues, like most of us are in today's time with physical health issues. Aren't we? So I go wherever there is a need on any platform, anywhere. I get an invitation from. So Bala invited me, so I said yes.
Okay, thank you so much. Thank you so much for agreeing to come on. So, as you know, our subject today, like I said, is very, very interesting. We're talking today about obsessive compulsive disorder. What exactly is it and what are the symptoms?
So, so to begin with, for an average person, so we will not, I don't want to dwell too much on the, the technicalities. So what happens is in mental health, all disorders or all illnesses are classified as per very well-defined criterion, if you like.
Right.
So, you need to meet the requirement of A, B, C, D, E, F, and then you get the diagnosis. So OCD, if you look at the actual manual, is quite a very discrete, defined, episodic illness. So, so a person suddenly becomes over involved with a particular thought. Okay, so he gets stuck like a loop song which we hear sometimes, or if an old record is stuck,
Right.
so you would have the same thought repeatedly, and the thought can be very disturbing. So, somebody who's very saintly and religious, suddenly he will get blasphemous thoughts, and he feels like, oh, I'm a papi, I'm a,
Okay.
that kind of a thing. So these thoughts are recognized as one's own. They are repeated in spite of trying to stop them, resist them, and they disturb the person, makes the person very anxious. So they get caught up in it and they don't know what to do with it. So that's the obsessive part of the OCD. And the compulsive part is where one is kind of by these feelings, one is compelled to. So you get a fear that, okay, I might have got COVID because I went out and touched the vegetables, for instance. Yeah? And then you want to wash your hands, and you just wash them and sanitize your hands, and then you get an urge to do it again, right?
Right.
Feel better when you do it, but then after a few seconds or a minute, you're like, yeah, I think they're not very clean. You go and do it again, and then again, and again. So the compulsive rituals can be checking or hand washing commonly, but they can come in various guises, if you like. So if a person has at least a few weeks of continuous obsessive symptoms, compulsive rituals, then you get a diagnosis of OCD per se.
Okay. So there are normally usually we talk about OCD as a hidden disease. Why is it so?
No, so this is the interesting part I was going to come to. So there is something called as OCPD, or which is the expansion would be obsessive compulsive personality disorder. So that's a lot of us have what we call as OCPD traits. So what does that mean? So a person with OCPD traits is a person with very high standards. He's a bit of a perfectionist, not easily satisfied. He will do everything to the highest possible standard, be very controlling in the demeanor. The quest for perfection is almost infinite. And, such characters are very successful in life, of course, because whatever they do it with full commitment having 100%, 110% commitment to what they're doing. They're not
Right.
easily satisfied. They make sure, check, double check, triple check every task that they do. Their wardrobes perfectly organized, their presentations immaculate. So there's a lot of features. There's a whole list of things that kind of give you a diagnosis of OCPD. Generally, such people have a kind of rigidity as a hallmark. They're very stubborn.
Right.
Uh,
Right.
and they're not like easily satisfied, if you like. So
Okay.
OCPD is very common, and it's a cultural thing as well. So it's phenomenally common. Say say the Germans, for instance. So when we talk about German engineering, everybody's like, that is dependable. So
Right.
everybody is going to be awesome, right?
Right.
So then that same perfectionistic tendencies just seen in Japanese as well. Indians, Singapore, for instance, almost every other person there would definitely meet the diagnostic criteria for OCPD. That is way more common than OCD per se. But in common parlance, what has happened is when people are referring to somebody who's kind of a perfectionist or a bit of a control freak, and so they say, oh, he's got OCD. So that's what the confusion is.
Right.
So
Right. Right.
per se is a very discrete illness, but OCPD is very common.
Okay. Okay. Now,
Or
yeah.
OCD traits are.
Okay. But then why do they call it disorder? Like, why is it OCPD? Because it's a good thing, isn't it? To be a
Yeah.
perfectionist, to have these high standards. Then why is it called disorder?
Yeah. So in mental health or in any kind of health setup, anything is a disorder if it leads to functional impairment. What do I mean by that? So by the virtue of being the way you are, okay, there are difficulties in your professional life and personal life. So how does it manifest? So suppose people talk about stress these days. Say,
Right.
Nupur, you and me are doing the same job, okay? We do the same task, and I do it with nonchalance. I finish it in an hour. Now, but you being the perfectionist that you are, you would take 6 hours to do the same task.
Right.
And you're still not satisfied,
Right.
You'll
Right.
you double check it, your research, you're like, what about that? And then you get caught up in that. You bring on a lot of stress on yourself.
Right.
You see?
Right.
So
Right.
when you're rigid at the expense of flexibility and adaptability, you bring stress upon yourself. Now, that's in the, say, professional realm. Now, if you talk about your personal realm, say your boyfriend or your husband, he's going to be walking on eggshells around you. That, I didn't fold the towel correctly, in the bathroom. She's gonna,
Right.
you know what I mean?
Right. 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 Right.
So around you are going to suffer. Suppose you become the boss of a team or whatever kind, right? So you will expect the same degree of standards, from everybody who's working under you or
Right.
at home. You've got a lot of misery that way, So
True.
in the evidence of that, clearly. Okay, and if you look at the strict clinical criteria for calling it a disorder, that's why I said OCD traits are very common. Okay, but disorder can only be called a disorder if by the virtue of your nature, there is problems for you or
Right.
people attached to you, and there's a clear evidence of that's when it's a disorder.
Okay, makes sense. And from before speak to, I did a bit of reading about this OCD, OCPD, and all of that, and it says 94% of a population suffers from one form or the other of OCD. Now, I probably think that they mean OCPD. I don't know, but
Yeah.
they said,
But
right?
where did you do this research?
Well, of course, Google was my best source, and some documentaries on Netflix and all of that.
Yeah.
So so this is what they say, that we have some form of, but they did not really use the word OCD, but they were more
Obsessive phenomenon.
specific in using the term intrusive thoughts and obsessive thoughts.
Yeah.
That's what they were more.
So having obsessional thoughts, having compulsive rituals is very, very common, almost universal if you think about it.
Okay.
Who amongst us hasn't had a thought which has bothered them when it doesn't make sense? So, you just check the gas. You're like, oh, I'll check it again.
Yes.
When you're going to bed at night, you're like, oh, you just check the latches and everything, and then now you're like, oh, have I locked it again? And you know you have, but you still go into it.
Correct.
So there is that. And under stress, see, so when one is depressed due to whatever reason, at least 30 to 40% chance of developing obsessive symptoms as well, as a part of your depressive syndrome.
Right.
So
Right.
you know how common depression is in our country or anywhere else in
Yeah.
the world. Experience of obsessional phenomenon is very common.
Okay. And is now, are there any different kinds of OCD?
Yeah, so I mean, if you strictly look at it clinically, so you can have predominantly obsessional phenomenon going, like which is thinking problem. So you get caught up in a useless thought and you can't get out.
Right.
Or you can get OCD with predominantly compulsive rituals. So you're not so bothered about the thoughts, but you have compulsive rituals like checking, watching, etc.
Correct.
That's again OCD. But when we're talking about OCPD, so you have to understand. So if your nature now, when we're talking about OCD, it's like an illness, like depression. It comes and goes. Okay, but OCD is you. It's the okay. So we are all we all have different personality traits and different personality styles. Our character, our very nature. No, but very nature your OCPD, then or OCP traits. Not necessarily. I mean, that's debatable whether it's a disorder or not, depending on who's looking. Right. So then you would have there's a list of 8 different problem areas. Now, if you have at least 4 of those, then you do qualify. But you inflexibility, rigidity, okay, central kind of core problem. So the striving for perfection, which is endless, so not satisfied no matter what, and need for control. So my world should be like this, my room should be like this, my car should be like this. And there's any change, there's like a bit of disturbance. So very interesting. So people with OCPD or obsessive personality are also very miserly because it's all down to control. So they were like really confused issues, and it's not needed. So like you'd be like a billionaire, but you'd be haggling with the vegetable vendor for 1 rupee, with the taxi guy for 5 rupees. So it's like miserly beyond what is actually needed. You have a tendency to find delegation very difficulty. So you can't trust anybody else to do any job. Okay, the standards you can do it. So you then obviously stress yourself out in whatever leadership role you are. You want to do everything yourself. You can't trust anybody else. So then there is a tendency to hoard as well. You can't let go of things. So बचपन के बच्चों के स्कूल के records अभी भी पूरे file up है. Yeah, you name it. Some old even if some things don't have a lot of sentimental value, we still keep a jacket. One day I might go to Kashmir, so I might need.
Correct.
You know what I mean? That's
correct.
So all things. So when you have these things, so you're not easily satisfied. You take a long time to complete tasks. So you have at least 4 out of these 8, then you can. I mean, that's all clinical. See, the point is, by the virtue of your nature, if you're stressing yourself out, okay, and that is leading to other illnesses and so on, of course, So, and if by the virtue of the way you are, if you're stressing everybody around you out, then it's a problem. Forget the clinical diagnostic criteria.
Correct. Absolutely.
And there is a solution to the problem. That's the beauty of it. The difficulty is an obsessive compulsive person will never think that they have a problem. Okay?
Okay.
Hence, they will not go to a doctor and say, Doc, I'm a perfectionist. I have a problem. You see what I mean?
Correct. Of course. Yeah, you're right.
In fact, they'll look at me and say, look at this doctor. He's not even ironed his shirt properly. Like it's all... And they have contempt for me because I'm not living up to their standards of appearance.
Correct.
So that's the problem. So how does it actually come to our center? So we see a lot of young people who are kind of victims of obsessive mothers or obsessive fathers or God forbid both parents, you see.
True.
So now that child kind of grows up with, including from personal experience, I'll tell you. So, when you have an OCPD parent, so you always feel as a little boy, little girl, you don't know any better, right? So you're seeking your parents' unconditional approval and
Correct.
acceptance. And
Correct.
whatever you do, they're always trying to nitpick, like, nah, sit straight. What's wrong with your hair? Why is your shirt not fully tucked in? Why are you eating like that? Why is food on your fingernails? So they will. There's a lot of love and care. Okay, but it manifests for the child in the form of this nitpicking. This nitpicking, the child questioning. The child who's just forming a sense of self, the sort of thinking maybe something's not right with me. And that leads to you having a sort of lowish self-esteem. That leads to you being more vulnerable to developing depressive disorders and anxiety-based disorders and so on.
Correct.
So that's the way we see it when young people present to us.
Right.
Do a kind of family kind of assessment, and we kind of get a clue, and then we do some work with the parents and so on.
Okay, that actually makes sense, because I'm sure most of our parents have done that when we were kids. Like
Yeah. It's a degree to pour that varies. So
right.
when there is something which is okay,
Right.
we survive it and live with it. But when it crosses a certain threshold, like I said, if both the parents are the same, it's a problem.
Correct.
So, because the child is like relentless.
Yeah. Poor child. So I can. Yeah. So since when you talk about this itself, you can almost identify yourself with that. So when you're saying things about OCPD, I can think of at least 3 things that I do. So like, oh, maybe I am in the 94%. You don't know. I mean, that's how we think about it, right? Now, then you said this word phenomenon, obsessive compulsive phenomenon. Now, what is that?
That's just like use of language, for me to kind of put across, like you just said, I've tried to explain the different versions of it, like the OCD, obsessive type, compulsive type, OCPD phenomenon, just obsessive symptoms in a depressive person, and so on. So now all these things are clubbed together, and you can call it the obsessive compulsive phenomenon. You know what I mean?
Okay. Right.
It's just because otherwise people get very, very worked up about the kind of diagnostic and linguistic issues there.
Correct.
But I think it suffices to say that it's this tendency to be obsessive, tendency to be perfectionist, a tendency for need for control, a tendency to get caught up in loops. These are all kind of similar phenomenology, if you like, when it comes to mental health experiences. Right? So I just use that term loosely. People use OCD so loosely. So almost all the time they're trying to, she's so OCD. She's always not happy. You know what I mean? But she's actually trying to say she's a bit of a perfectionist. She's OCD. So then, that's somehow unfortunately the kind of language around it has gone a bit kind of confused.
Correct.
So I'm trying to clarify that.
So does it mean that a person who has OCP traits is more likely to develop OCD as a disorder? I mean, is that?
Yeah. So there's lots of interesting research. So there's like half the papers say that it's like way more common. So if you're OCD by nature, so your tendency to develop OCD is like 60%, and some say there's no difference with the. So it all depends on who's looking at what. So when it comes to mental health research, we are always limited by sample sizes and generalizabilities and culture and so on. So the jury is out there, but clinically, it makes sense that it's more common if you have.
Right.
What is also very clear scientifically is that people with OCPD traits are more vulnerable to depressive disorders, particularly as they approach the middle ages and so on, because they have had to live with a relentless kind of internal master that has been like, Nupur, you're not good enough.
Right.
And that's what drives you to do better in life, and that's the sort of hallmark of success. But also, that is what sort of wears you down in the end. This is like endless, you know what I mean? So then it's very, very well known clinically that people with OCPD traits or OCPD full-blown disorder are more prone to mood disorders, depressive disorders, and so on.
Okay. So when we're looking at OCD, what are the causes for this? Why does somebody feel the need to wash their hands so many times, or feel the need to, what causes this?
See, basically, what drives it is anxiety. So these are all grouped as what we call as neurotic disorders or anxiety-based disorders. So wherever the person is not going mad in the sense he's not losing touch with reality or she,
Hmm.
but it's driven by a kind of fear. Okay, so the anxiety can be due to so many things. So for instance, your mother was a high standards person.
Hmm.
She was easily satisfied with you.
Hmm.
Okay. Now, without thinking, without knowing, you have internalized her standards.
Okay.
So that will live in your subconscious, if you like.
Hmm.
And your kind of normal circumstances, you'll be like, yeah, itna chalega, But then the internal master comes, hey, or say she has set a certain ethical and moral standards for you.
Hmm. Hmm. Hmm.
ये सही है ये गलत है you don't talk to boys for instance
Yeah. Yeah.
you don't hang out with boys till you're
Hmm.
kind of officially engaged and you happen to do that and then there's a tension between your kind of internal master and your kind of
Correct.
reality
Correct.
right
Absolutely.
that tension will generate anxiety so
Hmm.
anxiety is managed by obsessive thoughts and compulsive rituals
Right.
so what happens is suppose COVID situation mein typically somebody who's prone to these sort of a thing. Now he's worried that उसको control चाहिए ना कि life में सब कुछ set है, my job, IIT, then my son will grow up, will become a doctor, you do this, get married, house is set, pension set, and suddenly COVID comes. Boom!
Right.
This phenomenal amount of anxiety to deal with. So this anxiety is actually managed by obsessive compulsive phenomenon.
Okay.
It's like a tap on it. It's like a valve on it. That's the problem. So unless you kind of tackle the root cause of it, you will only do patchwork. It's a bit like suppose you have fever, right? I give you paracetamol. The fever comes down for a short period, but till I find out where the infection is in the lungs or the stomach or wherever and treat that, the fever is going to keep coming back. So these symptoms keep coming back till you kind of tackle the root cause of it.
Okay. See, from the, there are a lot of movies or films or, like sitcoms that are based on, that talk about OCD, like a disorder. For example, like I spoke about Monk. This is a guy it's a detective show where the detective is obsessive compulsive, in his...
I'm so sorry to stop you, but I haven't watched one. But
right.
I'm a big fan of Friends when it was on and all that. So
Yeah.
I don't know Friends.
Sorry.
The sitcom Friends.
Yeah, of course.
Yeah. No, Monica. So Monica is a typical OCD.
Okay. Okay. That's a good reference for us.
So she's not happy with. In fact, I've got a short clip of all her kind of OCD moments.
Yeah, there's so many.
So she's not happy with this, that, or the other. People are kind of scared around her.
Yeah, correct. Makes sense. Makes absolute sense.
It's obviously a caricature because it's a kind of an entertainment platform, but that's the kind of personality we're talking about.
So when we watch these things, it almost seems like a person is born and, it's a innate or a genetic condition, like they're always like this. But is that how it is, or does OCD come and go, or is it something you're born with?
Yeah, so
disorder.
So this this was obsessive phenomenon. Let's put it OCPD. Okay, let's talk about obsessive personalities. Forget OCD for a minute. It's very circumscribed, episodic kind of illness, which is separate in that sense. But just the OCPD phenomenon. So a lot of people are genetically inclined towards it. It does run in families. Okay, but it's very hard. See, like this argument in mental health is always: is it nature or is it nurture?
Okay? Correct.
You out there. But what makes sense is there is clearly a bit of both. Okay, so it does. So an OCPD mother will breed an OCPD daughter. You know what I mean? Because of her hardwire, her hardware, or her software. You see. So the brain is actually born with the sort of tendencies, and then that is kind of primed with the software and the experiences. You see, but if you think about so there is no doubt there is a genetic kind of linkage here, but also it makes a lot of sense to think about the kind of coding of the software that leads to one becoming this way. Okay, is experiences. So every day, just imagine a young person. Just imagine Nupur as I don't know, 3, 4-year-old, 5-year-old, just beginning to find her sense of self. Every time she shows something to Mama, who's like very high standards person, Mama says, "No, Nupur, you can do better." So and then so that gets coded.
Right.
Yeah, coding happens. So then young Nupur thinks, okay, so if I want mom's acceptance and love, okay, which I want as a child,
Right.
I have to do better. Okay, so then that becomes her rule for living. Whatever I do, whatever I take, I have to be really, really good. Only then
Right.
my mama or my dadi or my teacher will say, you got A star, no, okay.
Right.
Secondly, the two hallmarks of such characters are a quest for infinite perfectionism. Second one is a need for control. Okay, so why is there a need for control? So say when you trusted others to control your environment and your life, you got let down, you got hurt repeatedly. कि पापा आएंगे लेट हो गया भूल गए कुछ बोला भी नहीं and mama was gonna do this for me and she didn't do it, she's busy with her work or whatever, or so then when that happens repeatedly to a child, the child thinks if I control what happens to me in my life, then the chances of me getting hurt are less. So then that becomes the second rule for living. I control everything. My thing should be in its place. I should do this. I should do that. Then the chances of me getting feeling let down or hurt, that goes down. So you kind of without thinking, and this is the thing. So we think we are very insightful and aware and so on, but that's just the tip of the iceberg. Who we are, our kind of operating software is defined by our experiences from the moment we took our first breath. Okay?
Right.
It's all there. It's like the cloud. So it's all there, right? Every emotional kind of feeling, every moment that you endure, everything is there. That is what shapes and defines you, the person, right?
Right.
And you're not even accessible. Why you're being a perfectionist? You're not even aware that why you have such need for control.
Correct.
This is the way it should be. Why? You're not aware, but you have to live with those rules. So the treatment, if you like, is increasing that awareness.
Right.
Whatever. So now, just to add, so this is the confusion. So everybody loves a perfectionist. Any organization, any society. Who likes a callous? So say you or me, if I was dying tomorrow in a hospital, would I want an OCPD doctor to be in charge of my care or a casual doctor?
Right.
So I want the guy who will do everything that he can to save my life. That's the way societies, individuals will value those traits. And they're great things. Obviously, they are OCPD traits are the ones which lead to progress and advances and all the rest of it, right? And there's no doubt about that. But it is a two-edged sword. If you have OCPD tendencies, which is perfectionism and need for control, without maturity, emotional maturity, and awareness, and without flexibility and adaptability, it's a problem. It's a problem for you. It's a problem for everybody attached to you. So if say a classic example I use often is, say I'm a cardiovascular thoracic surgeon, and I'm really obsessive about how to do the stitching of the artery, which I'm taking from the leg and putting on the person's heart. When you do a bypass surgery, okay? So very obsessive. I will even shout at the nurse in the OT. I will hit a junior doctor if he makes a mistake. But I'm just like, not 1 mm should be left. The artery has to be stitched perfectly, because if I don't do it, the risk is this guy will bleed to death. You see, once I come out and all. So that's very justified because it's needed there, that level of perfectionism. But when the same guy, I walk out, I take out my scrubs, I'm tired, I go home, and I have a fit at my, I don't know, wife or a person at home who has just served me a chapati which is not completely round.
Mm.
What is this? You can't even make a round chapati, and I throw the plate and then I have a fit and create havoc. That's not acceptable. You know what I mean?
Right. Right.
So if I had the ability to be a complete obsessive dude in the OT, and when I come out, I'm okay. I mean, I'm adaptable. That's fine. That's healthier.
Healthier, right?
Easier said than done, of course.
Mm. So now that we're talking about both OCD and OCPD, the typical traits are both of them are intrusive. Both of them, don't allow you to function properly. So when do I say that the person has OCD, and when do I say a person has OCPD? What is the difference between the two?
So that's very important to clarify. See, so I said whatever we're talking about, park OCD aside for a minute.
Okay.
OCD is a discrete episodic disorder that comes when you either get caught up in a loop of a thought, which is very, very disturbing, or you get repeatedly do hand washing or checking rituals. I mean, people who wash their hands 100 times a day and their skins have gone. See, that's OCD. That's a disorder, that's an illness that needs medications, that needs treatment on its own right, of course. But what we're talking about, what people refer to commonly as OCD, is OCPD. That is your very character. That is who you are. That is the way from your teens till now into your adulthood, you are like that. Driven by perfectionism, need for control, miserly attitude, rigidity, all.
Okay.
That is what we are talking about. That is what causes a lot of distress to other people. You see.
Correct. Fair enough. Makes sense. So what is more common you're saying is OCPD, and we just casually say, oh, this person has OCD. My mom has OCD. My dad has OCD. My friends have OCD. Everybody has OCD. So, like you said, the thing is, this kind of personality is required, right? We need people who are like this, who will actually take us forward as civilization or whatever. And the fact is that they're also not even aware that they have probably a disorder. So, like, if I am an employee, or I am the child, or I am the spouse, and I recognize these traits, how do you talk to a person like this, who's already a control freak, who's already never going to accept what you're going to say? How do you get them to open up?
That's very difficult. That's why it doesn't happen. So that's why such characters don't come to doctors asking for help. Okay, and that's why there's a dearth of. If you look at relatively other personality disorders where you're emotionally unstable, or very shy and introverted, so they have a lot more research and options, because when you come to doctors, only then doctors will think about how to help this person. So when OCPDs across the world don't go to clinics saying I have a problem, then nobody really puts so much attention on it. Like it's okay. I mean, it's something. So doctors will give their attention and resources to things people need help for, right? But see, like I said earlier, what we see is that a lot of young people, a lot of, we see a lot of IT professionals, for instance, who've got a tyrant of a boss, okay? Or, the whole mill-dill saga. You know what that is, right? Mother-in-law, daughter-in-law saga. So if you got a OCPD mother-in-law, I mean, you talk to that daughter-in-law, what life is like. You know what I mean? So it's so common. It's almost every household, right? I mean, the other day I was talking to like some kids, and one of the teachers is like this. There are a lot of teachers like that. A lot of doctors are like that, right? So now the teachers are she's creating havoc in these kids' minds. She's not happy with the assignments, makes them do it 10 times, 20 times. She'll look for a fault. She'll make a red circle somewhere, like on the 19th time, say, do it once more. And they're all like terrorized by this particular teacher. Not good. It's not needed. That level of kind of control, that level of, you have to be contextual. You have to, be fluid. The problem is the rigidity. This person is doing this when it's not needed. It's so obvious to anybody with any common sense that what is she doing? You know what I mean? Or like a mother-in-law who would be a tyrant forever. I mean, I hear countless stories all day long. That she's not happy. Since I got married, my life is hell. No matter what I make, either it's too hot, too cold, too spicy, too bland. This is too much or too little. You
Correct.
said that every day there's drama. Every moment there's drama. You know what I mean?
Correct.
So then, when I'm helping these victims of these characters, I get interested. You see. So
Right.
what I do is, in the guise of doing family work, in the guise of doing couple work, I will invite them along. I'll even tell the wife who's a victim of an OCPD husband that tell him that the doctor's given you no choice. He's asked you to come along for the next session because he wants to your help to help me better, right?
Right.
So that way I would
Right.
have a sense of a relationship with them, and within that context, I can try and modify and give them more insight and so on.
Right.
So it's all very hard. That's why nobody does it.
So basically, we only, are you saying that we only get to these people with OCPD through the people they have traumatized? Is that how it usually works? Is that
Clinically, yeah. Clinically.
wow? That is really sad, isn't it, for the people around them?
That's almost all of us. I'll tell you that. It's not something which happens to unfortunate few. Okay.
Right.
There is no household in our land. There is no classroom or school in our land. There is no office in our land where there aren't characters like this.
Correct.
Okay. And they, by the virtue of their workaholism, their perfectionism, their high standards, they will climb the ladder. They will acquire the position of power. They love control anyway. And then everybody else has had it.
Right.
Probably a cynic, but that's what I see.
Yeah, that is true though. But that is true. If you're stuck with a boss who has a trait like this, or if you're stuck with a parent, I can imagine how hard it can be. Now, one very important thing you brought about is teacher and student relationship, or parent and children relationship. Because children, at some point, everybody feels responsible for them, like the parents or the teachers, and they think that what they're doing is in the best interest of the child. Okay, so if there's a teacher or a parent watching, what would you tell them? Where should they draw the line, and how should they manage this? Because whether they're making the child do it 10 times, 50 times, they're doing it because they want the child to learn or because they want the child to excel. So how do they control this, and where should they draw the line?
No, I think, if you ask me, I'm a total convert in this area. So, I would say, obviously, you cannot not have any boundaries and any interactive, but keep it to a minimum. See, because I'll tell you one thing. If you truly love your child, or if you truly want to be a good teacher, what do you want your child or student to acquire? A kind of self-motivated discipline, which will stand in good stead for him for the rest of his life, even when you're not around. Because by forcing, what you're doing is you're making an internal rebel out of him. The moment you turn your back around, they're just gone. They don't want to do it. You know what I mean? Depending on the activity and the circumstance, you should ask yourself, what is it that you want? You want long-term self-motivation and self-discipline, or you want a rebel? But clearly, one has to put boundaries in place, but you put boundaries with reason, with calmness, with consistency, with dialogue, with explanations. So, beta, I'm putting this law down because, okay? Otherwise, just keep watching TV or playing on the phone, and the homework will not get done. Your eyes will get spoiled. Your cognition will not improve. Your social skill will not improve. And you have a dialogue at their level of understanding, and you do it consistently. That this is it. Isn't it fair? So it's a bit like I think the difference between autocracy and democracy. You don't hate down anything to anybody for that matter.
Correct.
There's a child or an adult. You know what I mean? If you do it with explanation, with reason, with consistency, with rationality, and it's a struggle. Okay.
Correct.
Naturally, we would all want the most well-behaved children. But then what's the point of life? We could even create a software for humans, and everybody will be so robotic and everything, all the endeavors, and it'll be all over, right? But I think remembering that the long-term outlook is important, and you have to be firm and you have to be tough with your children.
Correct.
But with humane touch, for sure, always.
Absolutely. Now, since you have, I don't know if you have how many people with OCPD have actually come to you on their own, but if they have come to you on their own, what drives them to come to you?
But like I said earlier, see, they would get depressed at some stage.
Hmm.
Okay, so uh, depression. This is the other thing. Depression is also very, very ill understood term.
Hmm.
Okay, so depression is not just your classic textbook low mood and loss of motivation and energy. You're not eating, drinking, not sleeping adequately. That's classic symptoms, of course. But in real life, what we see is, depression manifests in the form of excessive health anxiety. So one becomes uber conscious about their body and their health, and they're just worried about every little symptom that comes, and they're going
Hmm.
around
Hmm.
seeing doctors. So depression can manifest in the form of irritability.
Hmm.
Okay, so one becomes by nature they were very calm, composed, rational people, and now in the last few months they've just become very snappy and
Hmm.
judgmental,
Hmm. Hmm.
shouting, at people and losing the cool on the road, and so on. So an exaggeration in your pre-existing personality, an obsessive person becomes
Correct.
more obsessive. He's now more obsessed about his roundness of his chapati,
Hmm.
or whatever else, So when there's a change in personality of that nature, which is more dysfunctional, so that's the way they would come when they are like really down and out. So and depression can be very, very severe in OCD traits because it kind of takes years for the build up. Finally, when the break happens, it's very hard to put it back together.
Right. Right. Right.
So when they themselves have a mental health breakdown,
Hmm.
as popularly known as nervous breakdown,
Right. Right.
so
Right.
that's when they would come our way. We'll try
Okay.
and help them with medications, with counseling, with therapy, all sorts.
Right. But I would also assume that I mean, I'm assuming this from a complete lack of knowledge, that somebody with OCPD, for that matter, would probably not even accept that they have actually had a nervous breakdown or a mental. Wouldn't it be harder for them to accept that something went wrong with me?
Yeah, absolutely. And that's the challenge. I mean,
Right.
my biggest challenge is to convince an OCPD person to take one pill a day. And I prescribe non-addictive, simple, safe, tried and tested molecules. I'll give the lowest possible dose and then build it up according. No. Because what happens is, see, you have to think that with that character structure, there's also a lot of pride that comes with it.
Correct. Correct.
So this sort of log kya kahenge? I call it hati ke daat. you know
Huh. Huh.
they always have this they're so appearance and what do people think notion,
Correct.
right?
Correct.
So
Correct.
now this is accepting that I have a mental health problem. Okay,
Hmm.
is a big crack in the image that they have developed for themselves and for the whole
Hmm.
world.
Hmm.
Okay,
Hmm.
and they will fight tooth and nail to not to go there. And that's a big problem.
Correct.
That's a
Right.
problem. The reason why that such characters don't seek help,
Hmm. Hmm.
unless there's a big crisis so they come when there's a divorce going on, or impending divorce, or a job loss, or a physical health problem that is like the physicians have said, dude, you got to go see now,
Right.
because we've done everything we can, that sort of a thing, and they still resist and fight and struggle, and
Uh,
so it all depends. So this is where our skills come in. So
hmm.
now,
Hmm. Hmm. Hmm.
if I say, I just keep saying Nupur, but you're in front of me as well.
Yeah. Right. Right. That's good.
You're in that situation, and you come to me by hook or crook, right? And you just connect with me, and you believe that okay, this guy knows what he's talking about, and he makes sense, and he's not gonna force things down my throat, but he's
Hmm.
giving me the options, he's educating me, he's telling me to try something to make my life better. So if you eventually develop the trust and faith in me,
Hmm. Hmm. Hmm.
and what we call it as therapeutic alliance. So when there
Okay.
is that bond, there's this bridge, there's this connect, then there's a chance that they might come around, but it's a struggle,
Right.
I struggle
Yeah,
with
so
it.
I can actually imagine you telling them something and then just not accepting it because that's their personality, isn't it?
Yeah.
So tell me now, in your experiences in meeting patients and all of that, of course, without disclosing your names or anything, can you talk to me about one of the most difficult or bizarre cases of OCPD that you have come across? Something that's unthinkable.
Yeah, I mean, you're getting me started. There's numerous cases. I mean, when you say bizarre, okay, so something which should be very interesting, isn't it? Not, but I mean, typically I would get mothers, So this is the other thing for the ladies who are going to watch this or listen to this. So what happens is, so all of us have OCPD traits because of our culture. Our mothers had it, our dads had it, we've acquired genetically and otherwise, and it's kind of dominant, it's kind of manageable, life is. And then, women hit perimenopausal age. You know what I mean by that? So
Right.
2 years prior to menopause,
Right.
2 years post. So those 5 years, 45 to 50, tricky years, okay? Because the level of estrogen and other sex hormones in your body, they just completely dry out. Your brain kind of depends on that for your functioning as a woman. Now, at that time, the risk of one developing depression, anxiety-based disorders, and exaggeration of your pre-existing traits is crazy. I'll just give you an example of a young man who came to me last month. So he's only a young person, like 15, 16. And so parents were very worried about him. This guy has become aggressive and rebellious. Okay. And he doesn't study in the lockdown time. He's just been going out all the time. And if you stop him, he gets very aggressive. Okay. So in the first 1 or 2 sessions, I was just generally inquiring and I kind of made friends with him, And then the third session, he opened up and he said, no doc, I've been smoking weed. Okay. So he's now in 10th grade, 11th grade. And he said, I said, okay, take me back to a time when you were not doing all these things. He said, 7th, 8th. Okay. And what happened? I don't know, doc. Mom just got very, 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 very finicky at home. Whatever I did. So he picks up a cup. And then, you didn't wipe, the ring which was formed under Doodh ka mark, and there'll be a big showdown, right? You didn't pick this up. You didn't keep your shirts in a nice stack. Everything, he got so fed up. Okay, right. So I started spending more time outside with the other older boys, and then they kind of brought in the cigarette and the joint. See, this is the way. And so I put it together because mom's now 52. Okay, so 3 years back, she was in the middle of the menopausal storm.
Right.
And that's what led to this boy kind of going, a very bright boy, very, very, a boy with a lot of potential. But now he loves the weed because it gives him a bit of peace, which he doesn't get at home, right? So then so his grandma is like that. She's a nitpicker. Now mom became that way. He couldn't bear it, So, so there is one case that comes, very common one, which I think happens in a lot of households, honestly speaking. I know of couples where the wife's OCPD drove the man to, because in those days, divorce wasn't an easy option, or as easy. So I'm talking about couples in their 40s, 50s, the man's cirrhotic, liver's gone, because he just found his peace in the drink, at night, when I'm drunk, I can tolerate her, her we constantly, that sort of a thing,
Right.
But various thousands and thousands of manifestations. I can't even, just OCD, okay? OCD symptoms. So you would get very interesting presentations. So there was this Pujari who came to me from a kind of semi-rural area. He spent all his life, he was born in a Pujari family. His whole life has been cleansing the temple, doing puja and doing the arti and all the rest of it. Suddenly, in his 30s, he's now started getting this thought that he's having sex with this Devi he reveres.
Oh,
and it just disturbs him. Like, oh, and all the rest of it. Like, but in reality, it's got nothing to do with his intentions.
Right.
A young girl in UK as well, she came with severe disturbance, emotional disturbance. So after she calmed down, we spoke. And the problem was she read this news article about a couple running a nursery nurse, for young children. And they were taking kind of pedophilic photographs of babies and posting them online or selling them online. There was a big news in UK at the time. And she read that and she was working in a nursery nurse. So she started looking at the babies in a like, whoa, looking at the genitalia, and she starts to panic. Like, whoa, I'm a bad person. You know what I mean? So
Right.
this would be the last one to have any such tendencies. But
Right.
just the fact that the thought has come in and she's trying to fight it, then it becomes like a whoop, 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 you know.
Okay.
Another young person. So she was very, very close to her OCPD mom. And mom died in 38, 39, just like that. Okay. Nothing happened, heart attack, I don't know what, And this is the only daughter. And she was a medical student. And since then, she had developed severe depression, anxiety, obsessive symptoms herself. And she had been through so many doctors, so many medications, so many therapy sessions. Nothing is kind of really making a difference. So I kept seeing her weekly and gave her the optimized medicines and so on. And she's doing well otherwise. Finally, she kind of really got in touch with the feeling. So the mom was such a tyrant while she was alive that she had controlled this girl like throughout from day one, right? This is what she will eat. This is when she will sleep. This is what she will do. This is what she will think. It was that kind of an existence. So when mom suddenly died, obviously it was a big loss for her, but a part of her felt very relieved. You see what I mean?
Right.
So now that generates a lot of guilt. So what kind of daughter are you? You're happy that your mom's there. You see, but she heard this and she was like, that wasn't acceptable to her. For years, she suffered and suffered and suffered and suffered. And so, I mean, countless stories I can give you, how people are affected by this phenomenon. It's crazy. And nobody talks about it. Nobody wants to do anything about it. People very stupidly celebrate, people who, I see a perfectly presented person, Nupur, honestly, first time I like, particularly these guys, okay? So, like, baal ekdam perfect hai, shirt perfectly pressed, perfect pressed. I like, okay, so sit down. What's the problem?
Right.
Celebrated all the time, like on social media. So you see a perfect photograph, like, wow, she looks good, he looks good. But do you know what goes behind that looking good?
Right. It must be exhausting, right? To always be so perfect and so. That's true. I mean, it's so exhausting that it is very believable that they're driven to other mental health issues. And it is. And the sad part is the havoc they're causing around them or around us. I don't know if I am one of them, but the thing is, we don't know what kind of havoc we're causing to people around us. So I think that's why this talk is important, not just to understand the condition, but probably somebody out there is able to identify, oh, maybe I'm doing this, and they could.
And the honest truth is, so the barriers to seeking like help are what? Lack of awareness, false ego in between.
Correct.
What's wrong with me? Look at me. I'm a successful CEO. Where there is a problem. You know what? You can't accept that. Right? Now, because of these barriers, okay, mainly the barrier of the ego, if you like, they're not seeking the right help, and they continue to suffer and cause suffering. And it's so sad. I feel.
Absolutely.
Because the point is, the treatment is not bypass surgery, which is going to cause you that.
Correct.
It's just talking. It is insight-oriented therapy work. Maybe a pill, and the pills today are not the kind of addictive, sleep-inducing, you fat kind of pills. The modern-day pills are so phenomenal. And that they change the kind of neurochemistry. That is sometimes what happens is with severe obsessive phenomenon, a person is like stuck. I'll give you an example. The classical was this guy called Henry. I used to call him Henry. So he had this thought. He went to a uber posh school, like the best school in England or something. All his mates, they all ended up becoming millionaires. Working in London in the finance sector and so on, driving Ferraris. And this guy, he was from a small kind of farm village community sort of a guy. So he didn't do that well. But the comparison sort of, he was genetically inclined to becoming obsessive, but he developed this thought that every time he looked at a person in a fancy car or an office building, he'd be like, What about me? What am I going to do? When will I, get my degree? When will I get a good job? When will I get a wife? When will I settle down in life? And he'll go to this loop of thinking on the same thing. So from the age of, I think 19, he started, till like completely cured him at 31. He was a wreck. I mean, people were giving him shock therapy and you name it, hundreds and hundreds of CBT sessions and so on. The problem was he was genetically very prone to developing this loopy kind of phenomenon. So finally, there's a specialist OCD unit in London where the professor recommended that I should give him this combination of medication, and that hit the spot. And that was 2000 and probably 8. And to date, he's really fine. Otherwise, you couldn't stand Henry for more than 10 minutes. No matter what you're saying, he'll be looking at you, and then you start off the same. What? What about it? And like, shut up, Henry. And this combination of medication just shut that loop. Okay, and he's working as a secondary school teacher. He's married with kids. He kind of sends me Christmas emails and so on now. Wonderful story. But there are. He's an extreme example, of course. So, like with everything else in life, there's a whole range of symptoms. Correct. Some are milder, moderate, severe, very severe, and so on. So that's our job. See, we will assess, we will define what's the best intervention that will help here and so on. But seek help, and we keep it confidential. Nobody needs to know. It's Correct. Between me and or the therapist and the person, so we can help. I mean, what's the problem? You can make your lives better. People don't mind going to cosmetic surgeons and spending lakhs. People don't mind going to the gym to get a little bit better body. But what about you? What about why not make that a better version? And the better version is not, that doesn't mean you become this blasé, no standards kind of person. You will just become more aware, obsessive person. Wonderful. When needed, you use the knife. When not needed, you keep it aside. That's what we aim for with therapy.
Okay. Now, this previous case you spoke about, this person is looking and saying, when will I do this? When will I do that? When will I achieve this? When will I... That sounds more like anxiety. From what I know, it sounds more like anxiety. So, is OCPD and anxiety do they always go hand in hand? They always go hand in hand. Okay.
Anxiety is ubiquitous. See, anxiety is universal. Anxiety is there. Anxiety is there from the first moment in which you got the realization that I am Nupur, this is Amma. The sense of I is the beginning of all the hell that breaks loose. From that time onwards, all we are trying to do is reduce that anxiety, and live. You see, so when it becomes too much, it manifests in the form of your personality becoming this way, or you developing illnesses and so on, anxiety-based disorders, the whole range of them.
So is one a symptom of the other?
What?
Like, is anxiety is OCPD a symptom of an underlying anxiety disorder, or it doesn't have to be that way?
See, this is the other thing. So the problem is all things mental health are layered and complex.
Right.
So it takes, I think, for an average person to at least have the confidence to sit and talk like this. It took me like 14 years of training, you know what I mean?
Correct.
It's because there's so many different angles involved here. So there's the entire neuroscience of things, and then the entire psychology of human existence, then the social factors, then the cultural factors, and then the current situation, having an understanding of what is, so it, all together can just tip the person over the edge or not. Or he's just teetering on the borderline.
Right.
So it's very complex to answer you.
Okay. So coming back to the other thing which you said that, there is a neurochemistry involved with OCPD. This is probably not something for anybody who's watching. Maybe you don't want to go into the science part of it, but just for me personally, because that's something I love to understand. So what really happens? What happens in the brain that causes something like this?
So we don't know. So it's very complex, but we know that there is something called as a hyper-serotonergic drive. So this phenomenon happens because of excessive serotonin in certain parts of your brain. And so we use SSRIs or antidepressant medications in relatively higher doses for a longer period of time to treat obsession. And they work like magic. There's no doubt about that as well.
Okay.
But the choice of the medication, whether to use medication or not, is very individual. It's very dependent on the individual person, the severity of their symptom, the context, and all the rest of it.
Okay.
Sometimes it's absolutely essential. Uh, Sometimes you can do without it. Sometimes you can wait and watch, and all that. But uh, therapy is always useful. But therapy in conjunction with medication, when appropriate, is the best way forward.
Okay. And is there any sort of a physical change that happens in, I don't know, your brain or the way your body functions that causes a disorder like OCD?
Medications.
No. Generally, to develop a disorder, when I develop a disorder, is there any change that is happening? Because it seems so, it seems so stuck and rigid, and it's there. It feels like it's almost a part of my brain is functioning like that. So, is there any change that happens in my brain structure, chemistry?
No, this is the whole thing. So all the mental health issues which we're talking about, they're all functional illnesses, more or less. So as of now, so people try to do constant imaging research and all that. So they take about 100 OCPD characters, put them through a scanner, and 100 OCPD characters, put them through a scanner, and see what's the difference. So they'll find some changes here and there, but nothing grows, nothing obvious, nothing consistent, right? So then what happens is there's not so much of a hardware problem itself, even if it is at a very kind of electron microscopic level. So now with the PET scanners, people are doing a lot more research, but we are very much at the embryonic stage of all that. But class these mental health issues as functional disorders. So there's no growth, there's not a neurological illness, you see. So it's not like epilepsy or a tumor or something like that. That's
Correct.
It's all at a very microscopic, electron microscopic level, whatever is happening physically. But see, the medications work, so we know that, and magically so, and appropriately used, changes life, no doubt about that. Yeah.
Now, is medication the only, of course, you said before that depending on the intensity and all of that. So what are the different treatment options available for somebody who has OCPD?
So, see, I'll answer this question very simply. Again, ideally, okay, all mental health issues are caused because of multiple factors. So what are they? Your genetics, your biology, your psychology, which is your personality style, your thinking style, and so on, and your social circumstances, your work environment, home environment, relationship status, and so on. The amount of drugs you use, alcohol you drink, and so on. So if you take all that into account, okay, so together they're causing a disorder. So to fix that, okay, you have to do treatment at all these levels, depending on the individual.
Right.
So medication, talking therapy, social interventions. So suppose somebody's stuck in a really bad mental saga for the last 20 years. So you somehow get the family involved and engineer that this person and that person, they kind of live on top of each other in separate flats for the matter, and then they have their own kingdoms to run, and they interface when needed appropriately, culturally, and life's much better. So if I don't do that social intervention, I just keep pumping pills into the person or keep doing therapy session, it will not have the same desired effect. So that's why it's multidisciplinary. So in any evolved mental health service, you will always have multiple professionals. So psychiatrists, clinical psychologists, psychiatric social workers, all sorts. Right? Only then you will get the best outcome.
Correct.
If a problem has its origin in multiple sources, then you have to look at everything. But I started this answer by saying ideally. So in reality, what happens? That's anybody's guess. But we at Empower, we strive to operate at a very MDT kind of level. So we'll always have psychiatrists, psychologists, and other professionals involved.
Right. Now, if I'm somebody who's watching this show and I notice, like I may have a few traits, that you're talking about, and sometimes I have an outburst which is which is unmanageable, or I have an aggressive outburst or whatever. But on the whole, I'm okay. On the whole, I'm functioning proper. But I have this on and off outburst or something like that. Is there anything that I can do to manage it or keep it in control? What are the measures I can take on a personal level?
So, if you're talking now only about OCPD character structure,
Correct.
now that's very common. Like that's all of us. 95% of doctors are OCPD, so right. All successful people are, right? There's nothing to be ashamed about. It's obviously, people say it with a lot of pride. I'm a bit of a perfectionist, So this is great, no doubt. But if you develop an attitude of self-reflection and genuine self-reflection, so when you have that outburst, so when you calm down, when you're able to kind of look at it more in a logical, mature way, that exactly what happened that day. He said this, I said this, he said this, I said this, but I was overreacting there. Maybe was I? You double check. You do a 360-degree appraisal of the third person who was in that environment. Like, honestly, tell me, and have that sort of humility to kind of own up to your contribution to any. I think we believe that if there is a problem, say you and me end up working together and we have a massive showdown.
Correct.
It's not possible in this world, Nupur, that the whole thing will be your fault or my fault.
Correct. Correct.
Okay, so there will be a circular argument there, depending on the perspective. So, developing a self-reflective, more mature attitude go a long way in one becoming more aware, more flexible, more adaptable. Key attributes for you to have successful interpersonal relationships in whatever context.
Right.
So nobody, including the so-called self-claimed gurus, which we see.
Right.
Nobody. Okay. If you are on this earth and a human being alive today, you haven't made it. We are all a work in progress. Some are a little bit ahead than the others, but it's the process. If you need the process, if you think I am very aware, I'm very mature now. It's the journey, So
no, absolutely.
You have to keep that open-mindedness, that self-reflective attitude, that ability to kind of take criticism constructively, seek criticism constructively, and gain more and more insight, awareness into your own operating style. That's the only way you'll become a more mature, a more wiser, and a better person going forward. Otherwise, most of us are stuck at some level.
Correct. And I think our egos play a big role in that. We will never accept our fault. We will never say, oh no, it's that person's fault only, You're right. So probably reflecting on what our actions sometimes can be a great way of doing it. And
also, see, I'll just add one last sentence to it. So having the intent, having the humility to say that, there's, this whole life's a journey of growth and progress. If I don't have that intent, I will not make anything else happen. See, so if you ask me, anything that stops degeneration. So, if when the urine is flowing all right, we are healthy. A little small stone comes in the kidneys of the ureters, and then you can die from it, right? So everything, when your food and digestion, it flows, it's all fine. If something stops, you constipate and you become ill, So likewise, our psyche has to flow and grow. That's the only way. Even when you're 90 and the guru of the world, Jagat Guru or whatever, you still have to learn and grow. And
Correct. So do you see any increase in OCPD or traits because of social media? This is something I really want to ask you. Have you seen that it has any effect on people?
When you say social media, are you referring to kind of Instagram posts and Facebook?
I'm referring to
the self-expression you're talking about. So with the advent of all the softwares that make you look fairer and leaner and all the rest of it. Yeah, obviously, isn't it? I mean, that's very kind of we call it narcissism, if you like, the self-love, the
Right.
self-interest. So it's a terminology thing, but it's kind of it all goes hand in hand.
Right.
People are not satisfied with the way they look. I mean, honestly speaking, when God, nature, kind of created humanity of this world, did they all did they intend all of us to look like a Ritik or an Aishwarya? Obviously not, right?
Right.
So we would have all been clones otherwise.
Yeah.
So we come in all shapes and sizes. There's a normal distribution of things. So the important thing is to kind of accept who you are as you are and do the best you can. Well, I'm not saying, don't take care of your skin, don't take care of your diet, just become a lazy, slob. Obviously not,
Right.
be active, be productive, we keep growing, learn, accept. See, when you accept yourself, a lot of your energy is released to do constructive things outside of you. See, the amount of resource and energy spent in appearance these days is ridiculous. Absolutely, unacceptable, to be honest, if you ask me, because it's just waste. What are you doing? Just this party pictures and you keep getting, I mean, I think most people who indulge in such behavior recognize it at some level, but they also get addicted to the number of likes and, it's a sort of man's need for social acceptance,
Right.
So now that it's just taken a different level with this. And it's all happens in such a short span of time,
Right.
But I don't know.
So this is my last question to you. What is the most interesting thing you've learned about OCD, or something that you really, which blew your mind, sort of thing?
Yeah. So this whole idea of what we call as the internal master, or in psychological parlance we call it the internal saboteur. Right? So the saboteur is a kind of boss man with a hunter. Nupur, not good enough. So now, where does it come from? I mean, why do some people have it in their psyche and some people don't? Yeah. So that's a very the whole Sigmund Freud. If you heard of Sigmund Freud, right? The whole Freudian idea of the model of the mind, where your conscious awareness is just the tip, and the whole of you, your personality is what is there in your subconscious mind or the unconscious mind. Now, within that, you have what he referred to as technically as superego, which is the moral standard beacon in your psyche. The ये सही है, ये गलत है. You know what I mean? This is sin. This is wrong. Right. So these things we acquire through our interactions with our authority figures. So like typically mothers, grandparents, fathers, teachers, and all the rest of it. The cultural icons in our times, if you like. ये गलत है. Now, sum total of that is this sort of, we call it the superego. So your superego, the moral police in your mind, is hypertrophied, which is it's like mota ho gaya hai, and it's like a stone.
Right.
So now Nupur doesn't live in that environment. Okay, she's in US, in LA, but अंदर बैठा है saboteur. Not good enough. You know what I mean? So, how to deconstruct that, how to make it pliable, how to make it adaptable and flexible is the challenge. Okay, it will only happen when you become fully aware of that hypertrophied internal master, and actually look at the origins of it and see whether it's valid. It's a bit like you buy an iPhone 4, okay, and 10 years down the line, you're still using the same operating system. You haven't updated it. So the software was coded when you were like 10. At 35, you're still operating on that. Obviously, you're not functioning properly. So it's insight, awareness, jagriti, whatever you want to call it. You've become aware of your internal saboteur and its origins, and then actually question that: do I need to use this stupid software now? You know what I mean? Or trim it down a little bit. This aspect of it. So that whole idea fascinates me. Okay, and I'm still trying to figure out what's the quickest and the best way of decalcifying the calcified.
Wow, that will be something to talk about, right? If you do figure it out, let us know. We'll have another chat.
Well, I think we should all try tie together. But I think the answer clearly would be in the insight.
Right,
Uh,
right.
another-
Just keep upgrading yourself, like
just keep
culturally, and maybe.
upgrading your awareness.
Hmm.
It's very, very bad, very badly used term. Everybody talks about I'm not aware. So it's just your that's you. Your awareness is you. How
Hmm.
do you make it more and more all knowing, all
Right, right.
understanding, throwing light into your subconscious recesses and like, whoa, okay, like this, and then the more aware you are, the better you'll function, I think. So,
Absolutely. All right, doctor, thank you so much. That was a fun talk. We spoke about a lot of interesting things, and I hope people who are watching, somebody recognizes the trait or is able to seek help, or somebody around them is able to say, you know what, you probably have this, hopefully.
I think, see, my idea is just to make people sort of more aware that
Right.
these so-called positive things can be negative as well.
Correct.
So
Correct.
this is the kind of yin and yang of life, isn't
Right.
it? So,
And probably
the-
somebody figured that, oh, all the stress is coming from my perfection.
yeah, exactly. So if I ask you, I do a random sort of sample on 100 people.
Ah,
Do you think strong willpower is a good thing or a bad thing? Most people, 99% will say it's a good thing. Of course, it's a good thing. Of course, it's a good thing. But
ah,
it can be the worst thing a human can have. Uh,
right.
and so that's the whole thing about life.
Yeah, true, true. It can both. It can be both, as long as we know how to use our traits
Yeah.
correctly. All right. Thank you so much. I will share this video with you soon, and you can pass it around if you want to. All right.
All right,
Thank you so much. Thank you so much. Such a pleasure talking to you. Thank
bye bye.
you. Bye bye.